inviting Dr. Hina Jawaid. She is a family physician trained in UK and currently working as assistant professor of family medicine in University of Health Sciences and really championing the cause of primary health care in Pakistan. So I would like to invite Dr. Hina from her talk.
Thank you very much to the worthy organizers. Special thanks to Professor Jawaid for giving us this opportunity. Our presentation is split into two parts. I won't take much time and it's not too medical compared to the internal medicine slides. So we'll talk about family medicine. I'll do the undergraduate, my colleague will cover the postgraduate. We'll just give you a brief overview of the number of institutions with family medicine department. Learning from regional countries, what others are doing. Future of family medicine and few slides on solutions, quick ones and easy. So we all know PMDC formerly and currently PMC issued a notification back in 2014. We haven't seen much change after that. And then the Medical Education Committee has already recommended 100 hours of family medicine in the undergrad curriculum. Why we need to include family medicine in undergrad? Now the figures that you're seeing are appalling actually. Only 14.3% of students in final year MBBS from 5 medical colleges in Lahore knew about family medicine. That is the level of awareness. One of my colleagues sitting as a panelist, he mentioned on one of the forums that when a few years ago he went to one of the medical schools to teach first year medical students, they didn't know about family medicine. This is final year we are talking about, and this is published in 2020, last year only. So we haven't made much difference. So why do we need family medicine in undergrad? Because we are heading towards universal health coverage, which means health for all, equity. Okay? And then the only way you can achieve universal health coverage is through family practice approach, and in order to deliver the family practice approach, you need a qualified stroke trained family physician. There are no two ways about it. It is as explicit as that. Why family medicine in the undergrad curriculum? Another reason, to build a strong foundation. What do we mean by strong foundation? What is the first interaction of the patient with the doctor? It's the consultation, isn't it? And that is where most of the problems occur. Hamari history taking kitni stringent hoti hai, we all know. Our data gathering kitni accurate hai, we all know that. So that forms one of the foundations. And if you see two words, communication skills and medical ethics, if you introduce that at undergrad, your life will be much easier. So the limited awareness, there are many factors. Some of them are lack of introduction at the undergrad stage, lack of qualified practitioners, lack of postgraduate qualifications in itself, and hence lack of departments, academia, and including research in family medicine. So how can you lay the foundation to deal with the limited awareness? There has to be a roadmap, there has to be a master plan. We need comprehensive primary care. Comprehensive covers both, not only the medical, the physical, it covers the psychological, the holistic care. And our physicians need to be aligned with patient-centric rather than the traditional care that we are giving at the moment. So there is a change in the concept as such. So the starting point is when your patient walks into your clinic and you see that is the starting point, and that has to be right. Because as a physician based in the community, you are influencing the decision that the patient is going to make. Management ki jab baat karte hain, when we give options to the patients. So this is what this slide is about. So decision making is very complex. Imagine a patient aapke paas aata hai, ill-defined number of symptoms ke saath, generalized aches, headache, dizziness, and you have to extract that information. So you need to have the tool, the training in order to extract that information within a given period of time. You can't spend the whole day with the patient. Now this is important. Sir का logo भी जो है PSIM का के evidence based medicine up now. So family medicine में भी evidence based use होती है. Even more important for family medicine. Most of our physicians are using clinical experience to run their practices. I think we need to shift that from the experience to evidence base. That's a major shift, okay? And that needs to start at undergrad. So limited awareness about family medicine among stakeholders. When we recently started a family medicine department in Gujranwala Medical College, and we run a clinic in a secondary care hospital, the DHQ, Gujranwala. On my first day, I had to tell the staff about, I'm not talking about patients, I had to tell the staff what family medicine is. So the level of awareness doesn't exist among our own peers, other specialists, the other staff, particularly nursing staff, because we can't work in isolation, we need the teamwork. So I had to literally explain for the first 2 days what family medicine means, what it is. And we do provide both clinical and non-clinical care to the population. Okay. So, I don't know if you can see this, but this is taken from the document Medical College Accreditation Standards and Inspection 2021 PMC document, and the red bit is where the family medicine is. It is included, but in the ranking it comes as a quality document, not a mandatory document. And the reason is there are not enough faculty and department. If PMC makes it mandatory and the institution doesn't have it, they will have to close that institution. That is why it's quality. Now this gives you the list of all the institutions across Pakistan that have a family medicine department. So most of them, about 7 of them are in PSIM. And in the middle column you can see undergrad teaching. Aga Khan University is the only which is offering 3rd, 4th and final year regular undergrad teaching. When you come down, Liaquat National is another. And then Ziauddin University regular 3rd and 5th year. So 7 institutions in one province and 3 of them offering regular undergrad. When you come to Punjab, there's University of Health Sciences, FMH, RMU has just had it. University of Lahore and King Edward are in the process of hiring a faculty at the moment, so they don't have a faculty. The FMH, Fatma Memorial Hospital College of Medicine and Dentistry has a patchy, so no regularity here. When you come to ICT, there is Shifa is offering regular, Health Services Academies, faculties here, they've just started. And then in KP, KMU hasn't got any undergrad, and Poonch Medical College in AJK, they also have undergrad. I'm not sure if they are regular or not. So the teachings at undergrad includes teaching the principles, as I said, holistic care, continuity of care, that is the fundamental. Then core clinical knowledge, wait symptoms, you identify what the problem is and take the patient forward. Clinical skills and procedures relevant to family practice, which is not that many. Who we can use to teach? Medical college academic departments, like some of us sitting here. Clinical placements in the community. We need the community orientation to work. Then we can also introduce training portfolios for workplace-based assessments. We can also include senior medical students, medical officers and postgrads who are still in training for the execution of the practical aspects. So focused history taking, focused questioning, ruling out the red flag signs, that is what's important. So once you teach them, you will see a different set of cohort emerging. You will see that shift from what we are practicing at the moment, shift from experience-based to evidence-based. Okay, and how a trained physician can help certainly bring down the disease burden. Like one of the specialists just mentioned, his father had signs of benign prostatic hyperplasia. It took him 5 years to have a PSA, and at that stage, the father had generalized metastasis. So imagine if he had gone to a primary care physician, a trained one, who was using evidence-based medicine, he could have been picked up earlier. So, references from, again, evidence, the references written at the bottom. Regions with high ratio of primary care shows better health outcome. Okay, NCD के levels भी कम होते हैं, जितना हमारा burden उतना नहीं होता है. And adequate delivery is associated with supportive government policy. There are again no two ways about it. You do need the government support. Learning from regional countries, I just mentioned Sri Lanka and Nepal are 2 countries which have undergrad family medicine included. And I was surprised when the chap from Nepal said there are 60 to 70 trained physicians they produce each year. They've got 3 years of training. It's a country with same resources as ours, predominantly rural country, but produces 60 trained 3-year structured program GPs every year. So the future, well, universal health coverage is here to stay, so we need to it's a wake-up call for us. When we had the meeting with PMC, they mentioned separate family medicine register and introduction of CPDs, appraisals and revalidation, so we are heading towards that in the next few years. Solutions, there is a fear factor among us about the reforms. I think we need to address that. Multi-strategy approach, one strategy, one size does not fit all. We need clarity, communication and open dialogue between public and private sector, which we haven't got at the moment. And we need specific targets and roadmap, very specific ones, particularly about referrals, which Dr. Daritmia mentioned earlier. Structured training is very much needed, can't run away from it now. And in the backdrop of severe deficiency of faculty, the sustainability of the discipline relies on training of the pros. Unless and until you train them, you can't have a faculty, full stop. Once trained, these physicians will need an environment. They can't work in the current existing environment. Imagine if you can't apply your guidelines, if you don't have the medications to treat high blood pressure. How are you going to practice? So the system needs changing as well. And integrating family medicine programs into national health policy, we can work on it at provincial level and at the central level as well. And developing a cadre to incorporate general practitioners, particularly in the public sector areas. These are my references, and I'll be happy to take any questions. Sorry, I had to rush because I was asked to. Thank you. Sorry, are there any questions? No?
As you have suggested PMC, why don't you give them a suggestion to put a postgraduate program for their practitioners? As we do FCPS or other things, why not